the cervical canal space is typically 12 millimeters or more, okay? So patients have, herniated discs, spinal stenosis, degenerative disc disease, all that starts to narrow that space down, which decreases your safety, okay? Elderly people, previous fusions, whatnot, so every time we're doing this, your safety margin is decreasing, okay? So typically somewhere around 7 millimeters, 6 millimeters, starts to get where your efficacy on an epidural steroid is going to get less. You can still do it. Typically on somebody like that, I would go below the level, and I use a catheter technique completely, which I highly recommend. So we go below the level of the stenosis and low volume, okay? So I had an elderly patient, this was about probably a year ago. I had an elderly patient who I knew, I'd known her for years. She'd always done super well, but she had an old MRI. Her MRI was probably 4 years old. And she had, at that time, she had about an 8 millimeter stenosis. Nothing had changed, symptoms hadn't changed, nothing. So I did the cervical epidural, and everything's fine, wasn't really big. It was a little weird kind of, I thought, spread with contrast, but it wasn't anything big. It ran out the nerve, and everything looked okay, but it was a little, And so went ahead and injected normal volume. I usually use 2 or 3 cc's total in the neck. So her daughter was there, and I asked her, how's she doing? I know her daughter for years too. So she's doing fine. And then I came back, 15 minutes later, and she's like, I can't move my arm. I was like, what? Can't move my arm. She couldn't move her leg. I'm like, uh-oh, what's going on? She had full sensation, okay? She could feel everything, just couldn't move her arm or her leg. So at this point, I'm going like, great. So I've either compressed her cord, right, or I've gotten a subdural injection. And the subdural was a little less because she still had full sensory, but she was starting to get motor deficit. So which basically is cord compression. And so, Dr. Rax talks a lot about, rotating the neck or the torso if you do get somebody that's stuck, somebody that can't move their arm or their leg, or it's really tight, and it opens up the frame and it opens up the space, the spinal canal space. And so I tried that, nothing worked, okay? Couldn't get it fixed, so I'm like, all right, great. So I called a radiologist, and her daughter picks her leg up and says, Mama, move it. And she picked her leg up, and her arm went, shoo. So by picking her leg up, she pulled the dura, freed open the loculated space, and fixed it, basically. So to Dr. Rax's point is you can maneuver out of a lot of things if you know what it is, right? So this is pretty clear. It was compression of the cord. And, like I said, her daughter lifted her leg. I didn't do it. Her daughter did it, and it fixed the problem, basically. Now, she still had a little bit of residual, weakness, so I took her to scan her, and we scanned her. And I was talking to the radiologist, and he was showing me the pictures. And he said, well, she's got about a 6 millimeter stenosis. And he was showing me the pictures, and you could see the progression as it was dissipating. I had compressed it with 2 cc's of fluid down to about 2. And then by opening it back up, she was able to regain function. So the point is make sure you know what you're getting into especially the cervical spine on a narrowed space, because that can happen without any change in symptoms or anything like that. So, that's just a little side, but yeah, it's not fun when that happens. So make sure you know what the canal diameter is, okay?